Hello guys, Assalamu alaikum. Welcome to Revised Pathology. Today we are going to discuss on the topic of Hodgkin's lymphoma. So, if Hodgkin's lymphoma, first of all, let's see what Hodgkin's lymphoma is. Hodgkin's lymphoma is a lymphoid malignancy. Okay, it's a type of lymphoid malignancy and it arises from the extranodal sites. Okay, where does it arise from? It arises from the extranodal sites. So, what is it basically? It is nothing but lymphoid malignancy. Okay, and it arises from the extranodal sites. And further, you will come to know what are the extranodal sites and which site does it occur from. Next, classical feature is the presence of Reedsternberg cells. This is one of the most important classical feature of Hodgkin's lymphoma. Reedsternberg cells. Okay, guys, this is very important for you. This is the most important even diagnostic feature you can say. What is it, my guys? My dear friends and viewers, it's also the most important diagnostic feature. Remember it throughout your life. So, presence of Reed-Sternberg cells is the most important diagnostic feature for Hodgkin's lymphoma. Next, once we talk about Reed-Sternberg cells, that time there is there are different type of Reed-Sternberg cells, and they're as follows. First one comes your polypoid type. Next comes your lacular type. The RS means Reed-Sternberg cell. Okay, so polypoid Reed-Sternberg cell is number one. Next, lacular Reed-Sternberg cell, pleomorphic Reed-Sternberg cell, and classic Reed-Sternberg cell. Let me repeat it again. So, what are the types of Reed-Sternberg cells? Is polypoid type, lacular type, pleomorphic type, and classic type. Sorry, huh? Classic type. So, these are the type of Reed-Sternberg cells. Next, let's come to the sites. At what sites, as I here mentioned up above in the extranodal sites. Okay, now what are the sites where we can find lymphadenopathy, and from lymphadenopathy we can take the sample by FNAC. Okay, which is fine needle aspiration cytology test that can be taken from these sites, and you will find inflammation or lymphadenopathy in these sites. What are those? First is the axillary lymph nodes, okay, supraclavicular lymph nodes, and cervical lymph nodes. So, guys, coming to the morphology of Hodgkin's lymphoma, if you see the morphology, first of all, we will go with gross and then the microscopy. So, the gross says that there will be a fish flesh like appearance, okay, okay, how fish flesh like appearance, and it will be gray white as well as it will be mated mass, large mated mass will be found. But guys, what will be fish flesh like appearance and what will be gray white and what will be a mated mass? There lies the question. So the fish flesh like appearance and the gray white will be the lymph nodes of those sites which are extranodal, that will involve some organ, some other organ's lymph nodes. Okay, and mated mass will be once the acute due to infiltration, due to infiltration, due to which a large mass will be formed. Fine, guys. So, what will be the morphology? It will be fish flesh like appearance, mated mass due to infiltration, and gray white. Of which one? Extranodal lymph node sites and or of an organ. Fine. Next, microscopy. Now, based on the microscopy, there are four types of microscopy in it. Fine. And first of all, how many types will be there? Four types. And they are as follows. First is lymphocyte predominance. Next is nodular type, mixed cellularity type, and last one is lymphocyte depletion type. So let me repeat it again. The microscopy are of four types, and they are lymphocyte predominance type, nodular type, mixed cellularity type, and lymphocyte depletion type. So guys, now coming to the clinical features are lymphadenopathy, low grade fever, splenomegaly, hepatomegaly, night sweats, and weight loss. Fine. And the lab findings are normocytic normochromic anemia, decreased serum iron level, elevated ESR, increased platelet count, and moderate leukemoid reaction. That's it. That's all for Hodgkin's lymphoma, and that's all for this video and for today. So, guys, please subscribe to my YouTube channel, Revise Pathology. DM me on my Insta, that is revise underscore pathology, and like, share, and comment on my videos. Bye bye.